As of today, the Department of Health says more than 7,100 people have recovered from the coronavirus. That is almost 40% of our cases. But how does the state determine who recovered? Action 7 News reporter Brittany Hope is live with the answer.
I have new information tonight from the Department of Health saying that recovery looks totally different for people who have symptoms and those who do not. So only on 7, I sat down with a UNM doctor to figure out how this all works.
So many people are walking around that have the disease, can spread the disease, and don't even know that they have it.
Infected, but have zero symptoms. That is the case for thousands of New Mexicans. Take a look. The Department of Health tells me 47% of cases are asymptomatic when they go to get tested.
They are testing positive. They're potentially spreading the disease, but they may not get symptoms for another 2 days or 3 days or something like that.
Some never get symptoms at all. So how does he and his peers determine if someone is recovered? The Department of Health and CDC early on had two ways: the testing method or the symptom and time-based method.
And so early on, we're like, man, we don't know. We're gonna make sure you have 2 negative tests before you're cleared.
But now that's changing.
They strongly discourage the retesting pathway, because what's going to happen is about 1 in 5 people are going to test positive by PCR, but they're really not going to be infectious.
You heard that right. You can still test positive weeks later, but not be contagious. Dr. Femling says that's because the nasal swab test can trace dead particles of the virus. This is why experts prefer the symptom and time-based model instead. The Department of Health tells me for people who do not have symptoms, they're considered recovered after isolating for 10 days after their positive test. For people who do have symptoms, 10 days have to pass since your symptoms first appeared, and they have to be improving. Plus, you must be fever-free for at least 24 hours.
Another question I asked the doctor is how experts decide when to leave someone out of the hospital and if letting someone out means they're recovered. He said people will only get released from the hospital if their breathing is getting better, and they will still have to quarantine at home before they can be considered recovered. Live in Albuquerque, Brittany Hope, KOAT Action 7 News.
UNM Presbyterian in Loveless stopped testing for asymptomatic people this week due to a shortage in supplies. If you think you were exposed, go to the Department of Health's website to find out where you can get a test.